name is Joanne Nguyen. I am a myofunctional therapist from Orange County, California.
How long have you been in practice for?
As a dental hygienist, that's what I did prior to becoming a myofunctional therapist. That was for 13 years. And then doing myofunctional therapy and specializing in that since 2020.
What is myofunctional therapy in a nutshell? Because sometimes people don't really know about it.
It is similar to physical therapy, but I work with the muscles of the face and the mouth, so like the tongue and the lips. And the basis is around having correct oral resting posture. So making sure that your tongue is resting in its correct position, that you have strong tongue muscles, lip muscles to help you breathe better. So when we don't breathe properly, especially when we sleep at night, it can lead to things like sleep apnea, which can start really early on, as early as infancy. Like we can recognize signs when you have like muscle dysfunction of the mouth and the tongue. It can lead to many, many common problems that typically will show up like really early on.
So, were you most frustrated with before the six-figure speaking makeover mentorship?
Not having guidance from people who have already been there, not knowing where like your next patient is going to come from, like your next client, and not having that consistent know-how of how to get the next client. I wanted to have a bigger impact and reach more people.
What made you decide to be a part of the six-figure speaking makeover mentorship?
Something was calling me already. I knew that there had to be a shift and a change, obviously, because I had those issues of not having like consistent flow of patients and income. And so I saw the posting of one of those webinars that you did. And I think what spoke to me was that you were holistic in nature. And then you mentioned doing it in a way that's like introverted, where you don't have to go and do the typical networking. And I mean, I could do it. And I feel like it's an important part to be able to connect with people, but it can get really exhausting, especially if that's not where your heart is or where you're comfortable, like having to just network and go out on social media and do like an Instagram post every few days or something. It just seems like it's exhausting. So that's really what attracted me to the program.
Any hesitation as you were making a decision to be a part of the mentorship?
I didn't know who you were, what you were about, just meeting you that like through the webinar. I definitely did have hesitation, like, okay, this is an investment. I know it's probably going to be an investment. Is it the right thing to do? Am I going to get results from this or not? So yeah, I did definitely have hesitation.
And then what made you decide to pull the trigger?
Testimonials is where it started because you have a lot of them. You have a lot of testimonials from providers just like myself, whether it was written or through video. So that was number one. And then number two is go off of feeling a lot, like, an energy. And so when I feel like something is right, I do it. So yeah, that was the second part. It just felt right.
Wonderful. You're a part of the six-figure speaking makeover mentorship and then have continued in our Introverted Visionaries mastermind. So let's talk first about the six-figure speaking makeover mentorship and then the mastermind. Like what's shifted for you after being a part of the six-figure speaking makeover mentorship?
Before the speaking mentorship, I was only doing talks to like one office at a time. Like I would go in and kind of give an educational lunch and learn. I wasn't speaking to larger groups, Um, even though I've done like quite a few talks in these offices, the techniques that you shared with us, like how to organize your thoughts and then what you're offering and your introduction and things like that. I felt like that made a huge, like a big difference. It just geared everything towards the goal. It brought everything together in a way that I wasn't doing prior. So what shifted for me was I booked my first like big talk. It was for like an international like association. So that was huge because I don't think I would have felt confident enough to do that prior, especially with what you showed us, like, that speaker one sheet. They asked for something that was similar, even though they didn't call it that. It just made it a lot easier to apply for that.
Yeah, congratulations. That's super exciting. And
Yeah.
how did it feel to do that talk? What was that like for you?
I mean, I was nervous. I almost talked myself out of it, but the person who was the person I was talking to set up the talk, she was busy too, and she was doing things during that time. And she said she was going to get back to me, but she didn't get back to me right away. And I think I reached out to her like once or twice, and she didn't respond. And so, my true self trying to talk myself out of it. I'm like, okay, I'll just wait. Maybe she'll put it off until next month, and then I'll have more time to prepare and perfect, my introduction or whatnot. As perfectionists, that's what we do. But I called her again and she said, I dropped the ball, but yes, we're still on. And so I had to like rush and get it done. But it felt really good. I was nervous, but it was a good nervous. I feel like it really pushed me outside of my comfort zone. And I feel like that's the only way we can grow as providers. I think discomfort is a very good place to be when you're trying to grow. I ended up giving the talk and I got good feedback from it. It was really great to finally get to do something on a bigger stage because I felt like I was always like self-doubting and holding myself in a bubble. Like it's what I wanted to do, but I was scared and I didn't know how to do it, how to go about doing it, how to reach out to these people and have the confidence even to myself, for myself, that people on this bigger like level will even want to listen to me. And so being in the speaking mentorship really helped me.
And how has that affected your practice?
It's been great. I'm in the process of booking more talks this month. I'm going to be reaching out and booking more talks in that bigger level. It's definitely given me more confidence to reach out and then book more, like on a bigger level.
Awesome. Yeah, your practice has grown, right?
Yeah, for sure. The practice has grown. I was able to increase my prices. I've been playing with whether or not to increase my evaluations. I used to price it at a level where I wanted it to be not so expensive so people can come in to get the information. And then perhaps after they get the information and they'll want to invest in their health and things like that. But I've increased prices on that. Before I was like at 149, that's where I was, but then I spend like an hour and a half in this consult and I do a lot in that consult and I offer like a lot as far as information and what I give them. And so I bumped it slowly. I kept playing with numbers. Like in my heart, I feel like I want to go over the 200 mark because that's where it feels right for the amount of effort and time that I put in. So I bumped it to like 175 and then I played with 185 and then I landed at 199 and then because I'm still trying to stay under that mark and I feel like it'll attract the right people and if they're ready for it, they'll invest. And so I'm at that point where I think I'm ready to increase it to above 200. Yeah.
What do you offer after your initial consult?
So I do a program of about 12-ish sessions. And currently my pricing is at 29.50. And so they get individual coaching and therapy with me throughout that whole process. And so let's say if they needed to have their tongue tie released, all the therapy to prepare them for the surgery would be included in that. And then all the wound management and all the therapy after would be included, whether or not they need a release. So it's not like they have to pay an extra fee for that.
What got you so into this and from being a dental hygienist to then wanting to do this more?
My son, the name of my practice is called Heart Myofunctional Therapy, and it's because my children are like the heart behind my practice. It was his issues that led me down this path, and I didn't really know they were related until I went down this path. As a hygienist, I knew what a tongue tie was, but I didn't know how much it could affect feeding, behavior, sleep, breathing. When he was born, he had trouble latching. He cried like for the first 7 months of his life, just wasn't a very happy, settled baby. The crying stopped at 8 months, but he had uncontrollable tantrums where it's not normal. He would go from 0 to 100 in like a second over some like minuscule thing that I didn't understand. I couldn't do the most natural thing, which is to feed him naturally. He would cry and pop on and off the breast all the time. So I went into depression for a very long time. I couldn't bond with him. I felt lost. It affected my marriage. I basically was out of my mind pretty much. He wasn't sleeping, and that was the main problem. And because he wasn't sleeping, I wasn't sleeping. So it was very hard on my whole family, not just him and what he was going through. And then he also wet the bed till he was about 7 years old. His pediatrician didn't know that there could be a connection from the tongue and sleeping and allergies. And then his own dentist didn't connect the dots. So I went to a continuing education course, and then that dentist was lecturing, and he mentioned how children with dysfunction in the mouth and like tongue ties, it could affect how they breathe, and then they can't sleep well. And then from there, all those other issues stem. So, yes, so that dentist changed things for me. So he sent me to a doctor in LA who was able to properly diagnose these things. And he said, your son does have a tongue tie. He told me that he needed myofunctional therapy first, and then that will help him prepare his muscles to get the tongue tie released. And then we would need to finish up the therapy to teach his tongue do what it's supposed to do. And so the day after we released his tongue tie, he stopped wetting the bed. And I was just like amazed because we were changing bed sheets every night without fail. And then his behavior changed. He stopped grinding his teeth, he stopped snoring, and it's like a progression, but it really made him like a different child. And it helped me make sense of what was happening. And it helped our bond, mine and his. And then it helped me, I guess, change even as a mother because I was very hard on myself. I was even mean to him sometimes because I was not in the right state of mind. It did so much more than just help him, which is already something incredible in itself because I really changed the quality of his life. In addition to that, it helped me and it helped my whole family. So, yeah.
Yes, that's huge.
Yeah.
Tell us a little bit about developing relationships further with medical doctors and providers.
Because I'm so passionate about this and I want to help other children and other adults, I decided that, okay, I have all this knowledge now. I could share it with offices and start like one at a time to spread the knowledge. And so that's how I started. I just visited offices that I felt would be open to hearing these things, like holistic providers, holistic dentists, chiropractors because it's related, like body workers and orthodontists and things like that. And so that's how it began. Some offices were already looking for something, like they knew that they kind of knew about it. So they're like, oh my gosh, I didn't know that you were here. I mean, we have to refer out and it's always online. We want to see someone in person. And so, yeah, that's how it started. And so it just slowly started growing.
Wonderful. And with the six-figure speaking makeover mentorship, how did that help you with developing provide relationships with providers even further?
Yeah, so I didn't know how, I mean, I knew how important it was to like nourish relationships, but I didn't have the tools or the techniques or like, for instance, like how often, do you reach out to them to like keep these relationships going? And even though it was like a speaking mentorship, there were tools in there that you gave us that helped us to know these things, like how often you should reach out and then how to actually nourish these relationships, like whether it be to send an email or to send studies that will help to support what it is that you do. And so just touching base with them and keeping top of mind so that you're in this relationship. It's not like you just meet them one time and then expect them to refer. It's really about building relationships with these providers where it can work both ways, like you're helping each other.
Yeah. And
Yeah.
tell everyone about how I remember you were really excited on a speaking makeover mentorship session where you're like, oh, I ended up reaching out to a provider you were already getting referrals from, and then you approached them with what we talked about, and then you ended up getting a referral. I remember. Can you share a little bit about that?
So I really like the sample that you gave us. So when I told her that, yeah, like I think it was the next day that she sent back a referral and she emailed it to me with their information on there so they don't get lost. So I thought that was pretty cool.
Yeah, awesome.
Yeah.
And what was it like to have the done for you templates and scripts?
Yeah, the done for you templates and scripts are really helpful because you don't have to think about things. Like it's one thing for someone to tell you, yeah, you want to reach out to these doctors and you need to build a relationship with them, but they don't tell you how. And so having those scripts are really helpful because you don't have to think of what to say. And one thing I will add is that let's say it doesn't like the words in there aren't 100% what you would say or what feels aligned with you, at least you still have that template where you can tweak a word or two or rephrase it the way that feels more authentic to you. But you don't have to think of like what to say. And so it was super helpful to have templates. Like I love your templates. You have a template for like everything you can think of. But yes, they're helpful. They're really helpful.
Wonderful. And how has this been different from other programs that you've been a part of in the past?
I feel like you always have an answer for the next step. And as I'm growing in this journey, like my entrepreneurial journey of running a business, it's never just like, okay, I'm at this level and I get this thing and then I'm done. You know what I mean? New things will come up and there's stages in your growth. And with other mentorships, I felt like they kind of helped me for that moment. But then I had questions because new things would come up. And then I didn't have answers to those questions. And then they didn't have almost like a next level for me. Do you know what I mean? And then I don't know, I just feel like you have a structure and there's always an answer for that next step. So it's not like I'm left in the dark or I don't know what to do or I have to pay like $1 billion to get an answer for the next step. It seems very attainable, if that makes sense.
And what was this mentorship experience like for you as an introvert?
It's helped me feel confident in the fact that you don't have to be an extrovert to make things work or to like grow your business and there's another way. I really resonate with that and I think a lot of your clients resonate with that too. I mean, that's why it's called Introverted Visionary. And yeah, it helped me realize that you don't have to do it that way and that you can do it like an introverted way. Not to say that there's not work to be done and then you don't ever have to push yourself, but it doesn't have to be so exhausting, like in that sense where you have to be around or do it that traditional way.
After you finished this Speaking Makeover Mentorship, you decided to continue on in the Introverted Visionaries Mastermind, where we're fast tracking growth and also really having the support and guidance and being around other people who are playing at a high level too. And so I'm curious, what made you decide to be a part of the mastermind?
In my mind, even when I did the speaking mentorship, I did it because I wanted to like be at a different level. I wanted to grow in a bigger way. I wanted to speak in front of more like bigger audiences and I wanted to reach more people. So I always knew from the get-go that it wasn't going to be like an end stop for me, whether it was with you or I didn't know what I was going to do next, but my goal was to be at a different level. I knew that there was something else, like a next phase, because sometimes it would come up or some of your testimonials would talk about this mastermind. And I've always wondered what the mastermind is, you know? But I want to be in it for the long run and I want longevity. And I don't want something just quick in that time. Like my goal is not just to succeed for like a year or a few months. And then what am I going to do after? I want longevity. And so, in speaking with you and then watching the testimonials from your other clients, and then some of my buddies now that I'm in this mastermind, I saw with my own eyes. You know, they were from your older videos, like they were in other cohorts of the speaking mentorship, and then they moved on to the mastermind. And I saw with my own eyes their growth because they would talk about it, you know, and so I just wanted, that's what I want, you know, I want to be there. And so I'm like, okay, it's here and, you know, you're offering it to me and it's been brought to my attention and it just felt energetically like I was energetically drawn to you. I don't know how else to say it, but it just felt right to me for where I want to be. And I saw how your other clients have succeeded and they're growing. And so that's what made me join.
And as you were deciding to be a part of the mastermind, any hesitation?
Yeah. I mean, it's an investment. And, in speaking even with people who have their own businesses, and they always say it's an investment, it's a journey. And it is a good chunk of change, So I was hesitant about that. I'm like, how am I going to make this happen? But, I feel like somehow, some way, you've made it attainable. I don't know how else to describe it, if it's my energy or just my growth um, as a part of being in that speaking mentorship and seeing how things have changed. I just felt like I can do this. So I definitely did have doubts, but I don't feel like you ever leave us hanging. Like, you offer support when we need help and when we ask. You always offer support. And I feel like the mentorship buddies and just being around them and seeing the questions that they ask, and it helps, like, to be a part of that community, because we all experience similar things, maybe on different levels, but it's all very similar.
What was it like to map out your 6 figure plus year plan?
Oh my gosh, Chen, that's that year plan and mapping it out. When I read it, okay, it was like midnight or something when I actually was able to read the email. And I was so excited. I read it and it just felt so aligned with everything that we've I've been like talking about. And I'm like, how did she do this? In my mind, I was like, oh my gosh, Chen, you're a genius. It's just like I felt like you really spent the time to get to know me and my business and my goals and my vision. And so to see it all mapped out and like all the ideas that you gave, even with like the visual frameworks and just like step by step how you put everything out, it's super exciting because I'm like, oh my gosh, there's like a blueprint of what to do. It's exciting, it's like super exciting. I'm very excited to see where all this can take me. Like, it felt so good. And I'm still in awe of what you came up with and what was in there, because I'm like, how was she able to do this when she's not a myofunctional therapist? How does she know these ideas?
I'm so
Yeah.
excited for you. Tell everybody about your vision for your practice that you're super excited about.
I mentioned that my son is the heart behind my practice. So, my bigger vision, when we were struggling with these things, when I talked to his pediatrician, he listened to me, but it was almost like I was reaching, and he doesn't even know to this date what myofunctional therapy is. I really would like to have that exposure where these like symptoms get addressed and recognized really early on, like in infancy. So it is my dream and my bigger picture to have like pediatricians understand the importance of like proper tongue posture and how that can affect like overall well-being. I just want providers such as pediatricians who work with children and very early on just to know, oh yes, they're having sleeping issues, or they're clenching and grinding their teeth, or they have speech problems, that tongue needs to be looked at, and is the child breathing properly? It's really my dream to have like pediatricians and providers who work with children to just know and screen and recognize these things so that the children can be helped and we can intervene early on, and we don't end up being like a whole society of like sick adults. Yeah, so that's my dream.
Yeah, because it's like it's not really mainstream understanding yet, and yet this knowledge and is out there,
Yes.
and it can be benefited by people from being children to adults too.
It's never too late to do this therapy. I mean, I have clients and patients. My oldest one is like 70 years old, so it's never too late to address the function of those muscles and to have better quality of life. But the earlier you start, the better, because it can really change the trajectory of how a person lives and how their quality of life, basically.
And what's the Introverted Visionaries Mastermind experience been like for you so far?
I really like the energy in the group. I love how some of the buddies will have ideas and then they'll just hop on and share an idea. And I love how we're all on the same path. Like we all have similar goals, wanting to grow, and then having that support, and everyone's just so supportive. Not to say that it's all rainbows and unicorns, because, we all struggle too, but it's been nice to be around a group of like-minded individuals who are all on that same path, have similar goals, and to be able to bounce ideas off each other and to know that you're not alone, because I feel like as a person trying to grow a business, it can get very lonely, and it's nice to have that support from you and then from all the other mastermind buddies.
I know you mentioned that you've always felt this like pull and desire to be teaching and educating more. Like, tell us a little bit about that.
Before I got into dental hygiene, I wanted to be an elementary teacher. I've always had that in me, wanting to teach, and I like children. And so I feel like in California, living in California, the cost of living is so high. And I think I didn't go down that road as an elementary teacher because I'm like, well, how am I going to pay for my bill? So, yes. And then I got into dental hygiene. But when I look back on those things, dental hygiene is all preventative care. And what you do, what you're supposed to do as a dental hygienist, is teach your patients how to care for their oral health, teach them about disease and things like that. But the way insurance-based dentistry is set up, a lot of hygienists don't have that opportunity to do what's at their core, which is that educational aspect. And so I feel like that's the part I enjoyed about dental hygiene the most. And then as a myofunctional therapist, I'm doing something very similar. I'm teaching patients these exercises, teaching them how to be aware of their muscles. And so on a bigger level, I would like to just educate with all the knowledge that I have, whether it's my 13 years of experience in oral health. The last 4 years, I was in holistic and biological dentistry, which really focuses on the whole body and looking at the big picture. And I feel like I have this wealth of information that I want to share with people. So it's that part about the oral health. And so it really has been this calling of mine to just do that on a bigger level.
Love
I
it.
just, and with your help, hopefully this year we can get that all implemented. Because,
Yeah.
I like to talk myself out of things and tell myself that no one will want to listen to me so that I don't have to like face challenges and be uncomfortable. But yes, I would really love to do that because I've been thinking about making those videos since 2017. And what year are we? And I think I shared that with you like the last time we spoke. But yeah, I think it's time. That's a long time to
It's
be
time.
on an
What
idea.
what was it like to map out your strategic plan from a 10x perspective, by the way?
I really enjoyed that part because I've been in, I think, two other coaching like programs. And we talked about where I see myself in 10 years and things like that in the future, 5 years or whatever. But it wasn't in the way that you did it. Like you actually mapped it out and helped me zoom out and really see, like you actually gave me like possibilities of what I can do. And I feel that your experience with your own businesses and then working with all these clients has given you like insight on how to help like business owners expand. And so I didn't even think that I could do some of these things that you mentioned. And then I've been kind of just playing with the idea like, how do I do what my first love is, which is dental hygiene, but I enjoyed the teaching part of it, like really educating patients and teaching about oral health. how do I mix that with myofunctional therapy? I've always thought I had to keep it separate, but you've helped me come up with something where I can mesh the two, which really feels great and amazing because I feel like it's more aligned with where I want to go. And it makes me happy because it's what I want to do. Sorry, I'm getting emotional. Um, when it comes to going out on your own and like running a business or growing a business, it's not an easy thing to do. And then when it's like you have to make money to put food on the table, or like a roof over your head, you start to kind of forget why you wanted to do this in the first place. And is it even possible to do what it is that you love and be able to help people in the way that you want and be able to have the life that you've dreamed for yourself? Like, is it even possible? You start to forget, and then you do things that are not as aligned with where your heart is. And then that's not good because it's not lasting. So I feel like looking at a 10x perspective, I didn't really realize like what you were helping me do, but you were helping me become more aligned with who I am and what I want and what my goals are. And it just felt really good because it made me feel like there's hope when I can really do what I love and pay my bills at the same time. Like
Yeah.
giving me that hope, and it's helping me like kind of move past and grow to another level because I was starting to feel like, okay, do I really want to do this? Yeah.
Yeah. Well, I love it. I'm just so excited for you. It's just what's in store and all the things that are unfolding for you and all the things that you want to share with people and educate and help. And it's just going to be awesome as you grow in this way. So, as if you knew then what you know now, what advice would you give?
I would say to really just trust your gut. You know, a lot of times we doubt so much and the voices in our head get so loud that we forget to really focus on what's important and what's inside. You know what I mean? And my gut, even from the way beginning, was to share about my knowledge with oral health, to speak on a bigger level. I feel like you were that kind of like a vessel to help me connect and go back to that. You know what I mean? And so the advice I would give is just to go with your gut and your feeling.
It's beautiful. We all have an inner knowingness, right? And so, what would you say to someone who might be on the fence as far as being a part of the mentorship or mastermind?
I would say do your due diligence in whatever it is that you're uncomfortable about or having discomfort over, whether it be talking to you, Chen, or reading more testimonials. Get over that hump so that you can trust that this process like works and Chen's not gonna take advantage and take your money and just not help you. But I would say, yeah, do it. I know that it can be scary because if you've never done it and there's an investment with the money portion, but whatever it is that is stopping you, I just trusted my gut. Like I stopped thinking and I just trusted my gut.
Well, congratulations again for taking this leap for yourself and going on the trajectory to going bigger, right? Like it's going to be really awesome when this is mainstream and providers know about it, people know about it, and it could really help with some of those issues like in a more underlying way. So I'm super proud of you and I'm excited as we continue to work together. Thank you so much for taking the time to be here with us today and sharing. And for those of you who are at a place where you feel like you're at a plateau in your practice and you just feel this bubbling up inside you, where you just feel like there's so much more, and you're capable of so much more, and you would love to help people in a more expansive way, then go ahead and book a free call with us at introvertedvisionary.com and look forward to connecting and seeing how we could help you with growing faster and in a way that really honors your strengths and also what you would love, like in a good work-life balance too. So with that, thank you so much for joining us and being here today.